All right, good afternoon, everyone, and welcome to today's webinar. My name is Jorge Acosta Palmer, and I'm the director of the Statewide Training Initiative with Florida Legal Services. We're excited to have you join us for From Coverage to Care, What Happened to Healthcare During Florida's 2026 legislative session. Before I introduce our speakers, I'm going to announce some quick housekeeping announcements. That sounded weird. So this training is being recorded. If you registered, you're going to receive a copy via Zoom within about 24 hours of the recording and a link to the materials as well. It's going to include the CLE code and link to the materials. The training was approved by the Florida Bar for one General CLE credit and one Health Law Certification credit. I'll announce the CLE code towards the end of the session. I will also drop it into the chat. And if for whatever reason I miss it, it will also be included in the email from Zoom and in the YouTube description once we post it. Closed captions are enabled for anybody who needs them. So if you're having any accessibility with the captions, just let me know. This training is being co-hosted by the Public Interest Law section of the Florida Bar, or PILS. If you're not familiar with PILS, I'm going to drop some links into the chat and in the email from Zoom so you can check us out. And final piece of housekeeping announcements are questions and answers. If you have questions during the presentation, please use either the chat or the Q&A feature. We will try to address questions as they come in, but if for whatever reason we miss it, we'll try to address as many questions as we can towards the end. So without further ado, it is my pleasure to introduce both of our speakers today. Our first speaker is Melanie Andrade Williams. Melanie is the Policy Director for the Florida Health Justice Project and a seasoned advocate with more than a decade of experience in public policy, coalition building, and community organizing. Her work focuses on advancing health equity, healthcare access, and social justice through legislative advocacy and strategic partnerships. Melanie is also a co-founder of Dream Defenders and has held leadership roles with organizations focused on voting rights, reproductive justice, and civic engagement. Our next speaker is Erica Monet Lee. Erica is a health policy analyst with the Florida Policy Institute and a public health professional focused on advancing health equity through policy, research, and community engagement. She has extensive experience building coalitions, addressing health disparities, and developing innovative solutions to improve outcomes for underserved communities. Erica is also a leader with Sisters in Public Health and an advocate for inclusive community-centered public policy. So without further ado, I want to pass it over to our speakers. I'm going to start with Melanie to talk a little bit about the Florida Health Justice Project. I'll be dropping some links into the chat about both of their organizations. Melanie, the
Good
floor is yours.
afternoon. Good afternoon. Thank you, Jorge. Thank you for having us. We're excited to share with you some legislative updates and what all went down this past legislative session, and also a little bit about what we're looking forward to, or not necessarily looking forward to, but what's to come in the 2027 legislative session. So a little bit about Florida Health Justice Project. I'll call us FHJP for short. We are a legal nonprofit here in Florida. We focus on health justice. So what does that mean? Well, we fight to expand access to healthcare and promote health equity. We assist on individual cases, so direct legal services. We advise and represent clients who are working through denials or being wrongfully terminated, so Medicaid, as well as cases dealing with kid care. We also do, so we have a robust legal team. We have attorneys as well as paralegals, legal assistants, and also like a community health specialist who also helps clients navigate. Sometimes there are other factors that are not just legal, and we have someone who also helps our clients navigate that side. On top of legal services, we also do education, advocacy, and we do a lot of coalition building, and we collaborate with partners, especially when it comes to our legislative advocacy. And then last but not least, storytelling. So when I say education, what does that mean? We're constantly writing memos, briefs, one pagers and fact sheets. The audience can defer depending on what exactly the need is. So we do have some public facing materials to help people navigating the system and help them to advocate for themselves, essentially. But we also do create one pagers and talking points and that sort of thing for lawmakers, as well as organizations that we work in coalition with. Myself, I serve as a lobbyist for FHJP, so I am our representative in the building in Tallahassee during legislative session, and I also manage our relationships with coalition partners. So we work with other legal aids, we work with organizations that organize direct care providers, as well as some like advocacy groups, so social justice focused organizations who prioritize access to healthcare as well. I'll pass it over to Erica to talk about a little bit about Florida Policy Institute.
Thank you, Melanie. So, Florida Policy Institute is a nonpartisan, nonprofit research organization. We're really focused on advancing policies that we believe are going to benefit the well-being of Floridians, no matter where they come from. And a lot of this looks like advancing an equitable budget as well. So we do this with the mission to improve that quality of life, as I mentioned before. And we do that again through shared capacity building, research, education, media conversations, coalition building as well. And we have an analyst that works in almost every area that you can think of. We have an education analyst. I am our health policy analyst. We have an analyst that's focused on safety net programs, another that's focused on our tax and budget, and another that's also focused on immigration and worker justice. And so we do this work every year, and we look to build those partnerships as well to do it. So, for the rest of the day, Melanie and I, as she mentioned, are going to go into talking about things that we really focused on between our organizations. This legislative session, FPI and FHJP are part of a broader coalition advocacy network to defend Medicaid, child health insurance, and things like that. So, anytime we see something that might cause some harm in those programs in the legislative session, we really band together to try to educate as to why those may be bad ideas. And then part of that work is coming back to the table and seeing how we can continue to educate and impact for years to come, not just what's immediately in front of us. Um, this legislative session, there were two really big bills that we worked on together. This was SB 1758 and HB 1453. This was a large bill that was focused on changes to the Medicaid program that were actually came from the federal level. So for context, last year in July, the administration passed a bill that they called the One Big Beautiful Bill. And this bill charged non-expansion states to implement work requirements in their Medicaid programs, amongst other things. Now, this was strictly for expansion states, not for non-expansion states. Um, and so when we saw these bills, there was kind of a number of them that we deemed, OBBB codification laws, meaning that they were taking what was passed federally and trying to codify it into our state laws, which was not necessary. And in a lot of cases, it went above and beyond what this bill called for. Other things this bill did was cut almost $1 trillion from Medicaid. And then we also looked at devastating impacts to SNAP program, supplemental nutrition and assistance from this bill that shifted a large cost of that onto the states that really just shrunk those budgets for those programs. And so, what we wanted to make sure was that Florida was not doing anything that was unnecessary that could cause undue harm. Um, Now, with this first bill, Medicaid work reporting requirements, we really understood that this was not an equitable bill just because, one, it was unnecessary, but also it created this larger issue where if anybody were to meet these work requirements in Florida, who is already utilizing Medicaid, they would actually get kicked out of the program for making too much money. One thing we have not done is expand our Medicaid program, so our financial eligibility for the program is extremely low. And anybody who would meet those 80 hours of requirements at minimum wage would then work themselves out of Medicaid coverage as well because they would make too much money to qualify for that, and they would still likely not make enough money to qualify to have private insurance or Obamacare. Um, And so we are Affordable Care Act care, as known as Obamacare as well. And so, knowing this, we really banded together both FPI, FHJP, and a large number of partners to, one, make sure that the bill sponsors understood the language in the bill and understood that this was not necessary. And that was a lot of advocacy work in doing that. Um, Now, the Senate version did pass all the way up until the end of legislative session. However, it was never heard in the House. And we consider that a victory, and mostly because, we think that we had the ear of a lot of folks in the House to say as to why this would not be good or necessary. And along those same lines, there was the other bill, HB 693, which was another one of these OBBA codification bills. And that had a provision in it that would have repealed coverage for lawfully residing immigrants. And the context of that being that we did have that every state has the option to eliminate a 5-year bar on Medicaid coverage for lawfully residing residents. And Florida had that option. And what this would have done would repeal that option. And so this again was a lot of conversations with some national legal partners back to our partners here on the ground in Tallahassee to say, do you understand this language and that this is not necessary? Was it your intention to strip this coverage? And luckily, we found out that it was not the intention of the bill sponsor to do that. So that was also walked back as well this legislative session. I'm not seeing any questions in the chat about those, so I will go ahead and pass it on to Melanie to talk about the others, unless you had something to add about the other ones too. We did a lot of this work together.
Yes, thank you, Erica. So I'd say on 693, that's definitely considered a win. Like the bill sponsor amended his bill to remove that portion, and I should have said there lawfully residing immigrant children because that's specifically what was at stake in the bill. So being able to, we testified in the first committee stop in the House. There was only two committee stops and we testified to that fact and we had coalition partners to also speak to it, and the bill sponsor was like, hey, I definitely don't want to go any further than what the new federal law requires. That wasn't my intention. I don't read the bill as doing that, but we can work, like, my office can reach out and work with these folks and make sure we remove that portion, and they did that. So that's definitely a huge win. These bills we expect to see again, and we're going to talk a little bit more about that later on in this presentation. So some of the proactive pieces of legislation that FHJP had filed that we plan to file again next session, and we worked closely with coalition partners on. But during session, the ball is rolling and so many things are popping up, but we keep in contact regularly. We meet weekly, and also many of I'm based in Tallahassee, but many of the partner organizations will send their folks up. So, we're attending committees together, we're scheduling meetings with lawmakers and staff together. And that's the perfect title for this slide, advocacy in action, because every day, like, you don't know what's going to change. And so being on the ground and being there in person was really helpful. Sometimes you can run into a staffer and get word from them before it's really publicly known that this bill, you're good, this bill isn't going to move, or we'll go ahead and amend this bill for you, and that sort of thing. So the proactive pieces. We had a medical debt bill filed. This was an exciting bill because it was bipartisan. Senator Ana Maria Rodriguez from South Florida had already filed a medical debt bill 2 sessions prior in 2024 that was looking to strengthen some of our protections for consumers in the state of Florida. And so we reached out to her. She said she'd be interested in filing something to go a step further. We showed her some model language, and then we spoke with representatives in the House, and we really wanted to have, we wanted this to be bipartisan. We wanted this to be something that obviously both sides care about this issue. They talk a lot about affordability being one of the main priorities of people on both sides of the aisle. It's a main priority of leadership in the Senate and the House. So we figured, hey, we should try to get somebody to file this from both sides of the aisle. This bill, it did a few things, and we do want to go a step further next year because we do believe there is an appetite to get these protections clarified and get them in statute. So it would do things like, first of all, we don't actually have a definition currently in statute for things like medical debt collector, medical debt creditor. We have things that technically rarely happen, but they're not prohibited in state statute, so they could happen. For example, threatening to arrest somebody, foreclosing on properties. I think this is probably more common, but also included garnishing wages, reporting reporting medical debt to consumer agencies the same way you would with any type of debt, like credit card debt. And then the last main thing that this bill would have done if it passed is to limit the interest on medical debt to 2% per year. So when we think about debt, and we talk about responsibility and the individual having to pay it back to the company that loaned them the money, we want protections because this is medical debt. This is much different. Many times people accrue medical debt because they either don't have enough insurance or they don't have insurance. So this is different from just spending, just overspending on a credit card and that sort of thing. So this bill did not move. It didn't get a hearing, but we're going to file it again. And we hope to have the same. Of course, Rep. Nixon is not returning to the legislature, but we do hope to have Senator Rodriguez to file this again. So we're in conversation with her. We had a few bills filed trying to aim at maternal health. So you all may or may not know, but we have maternal care deserts across the state, and that's not just in rural areas. That's also in some of our cities as well. We have maternity wards, labor and delivery units closing due to lack of funding, and that's something that we already had this crisis before the expiration of the enhanced premium tax credits from the federal level, but that and the state getting less money for Medicaid in the next 10 years due to the One Big Beautiful Bill Act, those things working together is going to exacerbate our situation with our maternity care desert. So we had a couple bills filed focused on doulas specifically, but there were many other bills focused on maternal health, reproductive health, and trying to expand access to reproductive services across the state, expand some of the pilot programs. Like there was a pilot program to allow for people to have their prenatal appointments by telehealth, depending on like if there's not a provider that takes their insurance in a certain radius, that sort of thing. But it was just a pilot for a small number of years, only in a few cities. So we supported bills like that to expand that and make it a permanent program and that sort of thing. But these were the two bills that we had worked with legislators to have filed. And we're just pushing to really, first and foremost, educate lawmakers on the importance and the difference that having a doula can make when you're pregnant and you're planning to deliver, whether it's in a hospital, a birthing center, or whether you're planning a home birth. So one bill focused on creating a pilot program in the Tri-County area in South Florida, so Broward, Miami, Palm Beach. And of course, we worked with Senator Osgood on both of these bills. She's in Broward, but she has really championed this issue since she's arrived at the legislature, and she wants to continue to push for this. So it would be through the Department of Health. It would cover doulas for folks who don't have insurance, and it specified like they would prioritize women who either used to struggle with substance abuse issues or currently do during their pregnancy. So really getting into the weeds of what the data looks like from DOH and trying to target the populations that may benefit the most. And that is specifically looking to just have better health outcomes, have better birthing outcomes, and ultimately decreasing maternal and infant mortality is one of the main priorities of all. If you ever hear about a maternal or infant health bill, that's the goal, right? Like we have deaths that are happening that are completely unavoidable. And so having a personal advocate, which is essentially what a doula is, can drastically decrease, your odds our odds of maternal and infant mortality. The second bill is a little bit different. It's something that, we looked at multiple states and we worked with a coalition of doulas and public health researchers over the past couple of years actually to think of some creative ideas and solutions. And one of the main things I've continuously heard over the past at least 3 sessions from doulas is that, they go through very in-depth trainings, they start to attend births, and they struggle with one going through the process to like become a Medicaid provider. So of course they're enlisting in this line of work to help people that need help the most, but then the hurdles that they have to jump through to actually have a sustainable business and a practice as a provider are just far too great, and they end up having to like it's kind of just work on the side, and they have to also manage a full-time job. So this bill focused on creating a workforce development program. We're still kind of working out some of the kinks. Some people think that this needs to be housed under DOH. Some people think that this is not focused on healthcare, and a doula is not a medical provider, so this needs to be housed somewhere else. So we pitched it as a Department of Commerce type of thing. And some people didn't like that. So I think we're still kind of working through that and figuring out where it should exist. But much like with other professions where you have a workforce development program, you have things like grant opportunities, technical assistance for free for new businesses and things like that. And that can really help for people to, once they become and they go through their certification and they become a doula, to actually stay in this practice and see clients. Because what good is your training and your expertise if you have to just work, a job in another field anyway, because you can't make ends meet as a doula. So that bill also did not move. But again, I think that there's certainly appetite on both sides of the aisle. The chair and vice chair of the Health Policy Committee in the Senate support doulas. They're interested in legislation that would target the populations who need that care the most, who have the highest risk factors and that sort of thing. Unfortunately, in the House, the appetite is not as great. Actually, in the Senate, the pilot program under the Department of Health did get a hearing, and it passed unanimously through that committee, the Health Policy Committee. But the House is a little bit different. So the chair of that first committee that this type of bill would need to go through, which is Health Professions and Programs. It might have been named something different this session because our Speaker of the House kind of did things a little bit differently, but it might have been like Health Facilities and Programs. But same committee function. That chair does not support doulas, and she thinks that because they're not medical professionals, it doesn't make sense to support this idea of a non-medical person like being in a medical setting, and that's sort of still debatable whether or not labor and delivery is a purely medical thing, right? Some people choose to do it outside of hospital settings, and they should have that right too. So yeah, we're gonna follow them again, and we're going to continue to do our work to educate lawmakers on what a doula is, the difference between a doula, a midwife, and an OBGYN, and the roles that they all play, and just making sure that we have healthy moms and healthy babies, which again is not it's not a controversial issue, but unfortunately sometimes even if it's not a controversial issue, it still takes time and sometimes a few years to get support for those pieces of legislation. So we'll bring that one back for sure. And did you want to share a little bit about our advocacy strategies? And I guess we could kind of tag team lessons learned for sure.
Yeah, sure. Thank you, Melanie. And before I do that, I did just want to address one question that was in the chat in case nobody was able to see it. Miriam asked if Florida has changed its eligibility to support, to reflect financial burdens families are facing today. My answer to that is actually no. Florida has maintained its Medicaid standard income eligibility, and right now that falls at about 26%, the federal poverty level. And in dollars, that's about $7,000 for a family of three per year annually. And yes, that is correct, $7,000. I know that's shocking. If Florida were to expand its Medicaid program, that would raise the eligibility level up to 138%, the federal poverty level, which is closer to $38,000 a year for a family of three. And also noted that if you are a childless adult, you do not qualify for Medicaid in the state of Florida, unless you have some other, disability or fall into those categories. But for the larger population, you must have a child as well. Um, so to our coalition advocacy strategies, Melanie mentioned that we do work together really well with other partners. And what that looks like are those consistent weekly, bi-weekly meetings. And when we find that we have an issue that requires more attention, we meet more frequently than that. Our coalition has great partners, not only from FHJP and FPI we work with, Unidos US, Catalyst Miami. We have SEIU in our bank of partners. We work with some national partners like Georgetown University. We also have more Florida partners, Florida Voices for Health, all the people who are continuously engaged in our space that we work with. And these are consistent meetings. And the coalition advocacy strategy is really just to make sure that we're connecting in ways that only enhance the work we do. So everybody knows how to work within their lane and their capacity while leveraging the resources that we have as a broader coalition. And that creates a beautiful synergy for us to do this work. We have great partners who focus on storytelling so they can actually get the people who compare with my data from FPI. We have FHJP, which is really focused on the legal front. So how do we incorporate that into our advocacy strategy? And it all just works together really well. But that's not without a lot of hard work and collaboration and consistency and organized meeting notes.
Organized meeting notes. That's a very good addition you have there. Look, if like our tactics are only going to be as strong as our notes. I mean, we can have all these ideas and conversations, but if we're not able to actually synthesize that and figure out like how to move forward, which happens in the note taking, then it's not looking up for us. So I'm glad you brought that up. Can you believe I've actually been in spaces where there's not a running notes document? It's a nightmare. I'm like, what are we talking about? What are we here for? I do want to mention because you talked about earlier, you were talking about SB 1758, and then right along with Miriam's question, the sponsor of that Medicaid work requirements bill, I guess you could say having our group chat ready and handy is one of our tactics because we have some people in person, we have some people watching virtually, right? So we're watching this Senate Health Policy Committee meeting unfold, and we've organized ourselves, just within each other, but then we also have the lawmakers and their staffers who we've prepared for this moment, right? So we know who's going to ask questions on the record, and we're waiting for the responses from the bill sponsor. And again, this is something that it's not always along party lines. So even if a Republican files a bill, some of the Republicans don't support what this person is doing. So it's interesting to see kind of how it unfolded. But to Miriam's question, it was mind-boggling. But the bill sponsor was asked, what's the eligibility limit like for Medicaid in Florida, and he even checked with his staffer before he responded. He looked back at somebody and like he was consulting with somebody, and then he said 138% FPL. And when I tell you the group chat was going off, multiple people who weren't in the building, because they do the question and answer period before public testimony. So they were like, somebody address him, somebody correct him. And of course, the lawmaker who was asking questions corrected him. But I said, I got this, y'all. So when it was my turn to speak, I already had my written comments, but I added that in there. And just his face, like if you could just see his facial expression, those little moments. And it's not really about, embarrassing this lawmaker or anything, but I think it's just to point out just how serious this is. I mean, they file bills every year, and depending on what's happening politically, some of these bills, it's political. It's not necessarily that there's a huge need within our executive branch to make these types of changes, and you don't really understand like where is this coming from? Why would you want to implement work requirements when we already have like such a small population in Florida who even can get on Medicaid? So then to correct him and remind people that, the dollar amount that Erica just said for a family of three, like that's the reality. Most, like if you ask a random Floridian, how much do you need to make in Florida to qualify for Medicaid? They're going to guess like 40 or 50,000 a year. And wow, wouldn't that be nice? So yeah, I just wanted to highlight it's super important for us to be in the building, not only to prepare to speak in these committees, but also to be able to be flexible and change our testimony, even if it's last minute, to make sure that we're getting the most impactful things into the record. For me, I think a lesson learned was definitely, I come from a little bit more of a, like my background, I've worked in political campaigns and I've worked for organizations that, they weren't legal aid organizations. I mean, they did things a little bit more. I've worked for partisan organizations and I've worked for social justice organizations, and so the attitude of lawmakers and staffers, sometimes it would be tricky for me to kind of just get my foot in the door and have serious meetings. So I think coming to this side of it and being able to say, like, this is not about red or blue, this is literally about the issue, and everybody being on the same page and supporting healthcare access in general. I'll say maybe in theory, right? Because like all of our bills should have passed if they truly supported it, in my opinion. I'm biased, but I think that was my biggest lesson, is just, being able to truly work with people regardless of their party to figure out how we can make good things happen. And those two bills dying, I think, was a testament of that. So definitely a lesson for me. I think we can move to the next slide, Jorge. Excuse me. So I will kick this slide off. So with the budget, this year, I mean, the past couple of legislative sessions, like they've just been, I think, some of the most interesting that I've participated in, because we just had so many legislative sessions. We had a lot of infighting, even like within the majority party. So that really slowed down a lot of the process. It seems like each year there's like a big front running issue that before session even starts, that this is going to be a thing. Last session, I remember, it was immigration. We had multiple special sessions before they came to an agreement on, the new immigration law they wanted to pass in order to align with the federal government's ideas and proposals around immigration. And this year was similar. We obviously we had property tax as our front running issue, but the budget, we had to end session without actually deciding on a budget, and then they came back for a special session on the budget before the special session on property taxes and getting that on the ballot. So it was very interesting to see. It's like they could not get on the same page. I think that it's where we're at in terms of the elections always has an influence on it. But I think we saw an interesting sort of decline of power with this governor, because before he bowed out of the presidential election, it was a much different temperament in our legislature. So our House and our Senate leadership were kind of in lockstep and always seemed to be on the same page, at least what meets the eye, of course, with the governor. And any priority that the governor put out in public, they were willing to make sure that those bills came to fruition. But with the current Senate president and House Speaker, that was not the case. And also they didn't get it. So there was a lot of clash between the Senate president and the Speaker of the House, and they did not have the same priorities. The main bill that our Senate president wanted to get passed focused on rural counties in Florida, and really trying to make sure that it wasn't focused on one issue area. So just getting the dollars needed for healthcare, for economic development, for infrastructure development, and that sort of thing. He really wanted to focus on that. And the House never even had a comparable bill. So they passed some of the things in smaller pieces, but they never truly saw eye to eye last session or this session. And then, of course, we have new leadership coming in. So we'll see what it looks like next year under a new governor. But they finally did come to consensus right before their deadline, right before our new fiscal year started this summer in July. And of course, health and human services is a large part of our budget. So they settled on 49.2 billion. And this is actually not just what the two sides, the House and the Senate came to an agreement on, but this is also after the governor's veto. So the governor did veto quite a bit of like the individual programs that were passed by both House and Senate. Things like funding going to one that stuck in my brain was like $1 million grant that was going to go to a local police department focused on mental health and behavioral services. Of course, there's a lot of funding for those types of services through different channels. But there's a lengthy appropriations request process that not only the local governments can go through, but nonprofits and businesses and agencies like can go through as well. And so he really took the veto pen harshly to those smaller project proposals. And from the way that the governor's office communicated it, it's like, each year that he's been in office, he's slowly slashed a little bit off of our budget. So he just wants to show that he is smart on spending and like, fiscally conservative. And so, I think having both sides agree to so many different programs that would tackle healthcare issues and health access issues across the state of Florida, like not really having a reason to take that money out of the budget besides saying, hey, look, I cut costs. I think it speaks volumes. So two of the main issue areas, of course, that our organizations focus on when it comes to healthcare: Medicaid and kid care. So we have this money for Medicaid that was, made it through the budget and made it through the governor's veto process. However, we don't know what this is going to look like moving forward. So I think the next fiscal year, so not 26, 27, but 27, 28, and then even 28, 29, like depending on what happens in November, right? So if we pass the property tax amendment, the money that's going into Medicaid, many of it that comes from local governments, that's kind of up in the air. So that's something that I know we're going to talk about a little bit like towards the end, but looking at next session, just wanting to get an understanding of, this is how much you've allocated this year. And I think it's pretty consistent with prior sessions and prior budgets. But what is this going to look like in the future, especially if we're not going to get the funding, the money from property taxes from our local governments. And of course, we don't have expanded Medicaid. So we don't have the billions that we could have from the federal government coming down into our Medicaid money. And I'll talk a little bit about kid care before I pass it over, and the my access issue that we realized as well towards the end there when the budget was approved, before I pass it over to you, Erica. And please add to the conversation around Medicaid and property taxes if you have anything for us. I know you're doing a deep dive research on that. But okay, so we have kid care. So there's money in our budget for what's called the Kid Care Stabilization Fund. And you all, I know you all take similar cases to what we work on at FHJP. So I probably will be preaching to the choir, but this funding is, we have our folks on subsidized kid care. So to make sure that, we're able to, we pay into that program to make sure we provide care to those families. However, we have a glaring issue here. And this is something that we worked on this session. There was no bill, but we essentially worked on kid care as more of a public awareness and education campaign, I would call it, because I don't think lawmakers realize that although they passed a bill in 2023 and the governor signed it into law, not only is it's still not been implemented, but the reason why the agency is saying that it hasn't been implemented is just not true. So we had press conferences, we met with lawmakers, we met with staffers, and we talked to reporters constantly. We testified in committee. So although there was no bill to speak to, when the agencies go up to give their updates on implementation of different bills, and when they go up to ask for money and they give their updates on their budgets, that's when we're able to, submit a request to speak for public testimony and really just hone in on this issue. So, ACA, they did a presentation. They actually put up a timeline on the screen to show lawmakers like, hey, you passed this and we're still working to get federal approvals. There were glaring differences in their timeline versus ours, which you can see at our website on the resources tab. They did get the federal approval that they needed to implement this expansion of kid care, but because they did not want to implement continuous coverage, which was a rule passed by the Biden era administration, they said that because we're suing on that grounds on continuous coverage and not saying that we don't have to provide continuous coverage for those parents who miss a premium, we can't implement this expansion of kid care. So right now, it's still at 200% FPL, and there are so many families. There are at least 68,000 children who could be on kid care in Florida who are not because we have not implemented that. So looking at the budget and seeing this dollar amount, like and it may feel like, okay, they're doing their due diligence, they're doing what they need to, but it's kind of when you zero in, you start looking at the fine print, you look at what the agency has been talking about throughout session, and you see that there's a mismatch here. And then there's also just money that the agency gave back that had us scratching our heads, because if you're saying like continuous coverage and you're not going to be able to expand this and have more people on and have that tiered system where people are paying based on their income, but you have money, I think it was around 30 million or so that you can give back into the general revenue. Like something's not adding up for us. So this issue will still be front of mind for us for session, whether or not we're filing a specific piece of legislation next year. And then real quick before I pass it to you, my access system. So, the Department of Children and Families has been working for 5 years now. They're going into year 6 of this multi-year project to change their internal system, the My Access system that folks use to apply for Medicaid and SNAP benefits and those things. And it's a tiered system. So like the My Access is still active and it's still being used, but there are still things within it that need to be changed so that it's more user friendly and just it makes sense, not just on the user end, but on the department end as well for the staffers who have to use that system. They needed 47 million this year to continue their project. And that money was only requested on the House side. So it never made it into the final budget. So we don't even know, like, what is the plan for how can you move forward with continuing this? And, that system is a big part of the issue with the way that people are wrongfully denied. I'm probably preaching to the choir, but this is when we talk about passing good laws and having bipartisan support and all of that's great. But what good is it if we're not able to kind of get past that finish line and make sure that the department is doing their due diligence and making these things happen? And it goes back to our advocacy against the work requirements bill, right? Because even though these things might seem like separate issues, if your department is currently not able to manage the workload and kind of address some of the outstanding needs in front of them, how are we going to create a new system or use the same system, but there's also issues with that in SNAP, to then expand it to the Medicaid population, which is a very small population? So we kind of look at the issue, like we cross-reference the issues that we work on to see if something can help us strategically in our fight in another area.
Thanks, Melanie. I'm going to briefly touch on these last few slides because I do see we're coming on time. We still have a little bit more, and then we wanted to leave some time for questions. As far as the Applied Behavioral Analysis Task Force, I won't speak too much on that since that's not quite my wheelhouse. I will say that there were changes to this program and its funding this legislative session. And ABA therapy is typically a therapy type that's more for children who have autism. And so there has been a concern with the shifting of those funds and how it will impact the Medicaid program overall. But I will leave it at that. Rural health investments that Florida got actually go back to this federal bill that we were talking about earlier, the One Big Beautiful Bill Act. Although it cut almost $1 trillion from Medicaid and billions of dollars from SNAP, what they did do was allow a $50 billion infusion of funds into every state, or it's federal funds of $50 billion that would go to states to transform their rural health programs. And so this is a new infusion of funds from the federal level. And the way it works is each state gets those funds split evenly, and that gets half of those funds split evenly across them. And then they apply for additional funds in that program to impact their state. So Florida has $209 million for this rural health transformation program that were announced last year for our budget year one. This is an initiative that goes on for several years, not just 1 year. And so with that, the state had asked for applications for this new infusion of funds, and that was an entire process. And just yesterday, the administration announced they did award $188 million of these rural health transformation funds to about 31 counties, and there's 80 awards that were awarded this year for that. If you care to see a list of who was awarded what, that's available right here. I'll drop it in the chat for you. And it's going to be a cycle of applying and receiving awards that will change year after year. Um, and those are some 15 targeted initiatives for rural communities to focus on to receive these funds. The last issue that was kind of in our wheelhouse a little bit this year was the funding for the Age Drug Assistance Program. That is a program that has helped Floridians access treatment for HIV for several years. And what happened was the funding was running out, and so there was a big task force that mobilized to figure out how to get more funding in this ADAP program because the funding was paused and there was no guarantee as to whether or not it would continue. Now, we did see that there was enough ADAP funding put into the budget for this year to continue. However, the concern is that that funding is not recurring, so we'll have to ask for it every single year with no guarantee that it will be funded. And so that's something that partners are focused on as well. And we can go to the next slide. So there are some things that we are looking to watch in going into the next year. We don't want these issues to return, like the Medicaid work requirements or the OBBA codification laws. So we'll be monitoring to make sure that in legislative session, things don't pop up that go above and beyond the One Big Beautiful Bill Act that was passed last year in July. And in doing that, doing that monitoring. Um, we just have to keep checking back in with our coalition. However, we have a great foundation to work off of, and we have a great education strategy and partners who are willing to mobilize around this. So that's one thing we'll be watching. Melanie mentioned earlier that we will be watching the property tax proposals. This is one thing that FPI has really been on the forefront of over the last few months, just because we understand that cutting these funds with this new property tax amendment would result in a loss of $12 billion across the state of Florida for direct county and community funds. It's been interesting to study how that's going to impact our healthcare services. As Melanie mentioned earlier, that will impact the county's ability to pay for their state share of Medicaid, which is mandatory. The state share of Medicaid is a mandatory 40% to pay to the feds to draw down money. And so every county contributes towards those Medicaid funds um, via their property taxes sometimes. And so that will have the ability to pay for that will be impacted. I have been studying how this will impact Florida's special hospital taxing districts as well. Many people are unaware that their property taxes help fund the public hospitals in their area. And I did see that there's going to be some property taxes that will be each hospital taxing district in aggregate, we're going to lose at least $300 million across the state of Florida. And some of these hospital taxing districts will fare better than others, but for some, 96% of their funds come from ad valorem tax revenue. And so I'm finishing up an analysis on this that will hopefully be published in the next week or so. But FPI does have webinars on this topic every other week. We have one coming up this Thursday. And so when I stop talking, I will get the link in the chat for you to register if you're interested in these ongoing conversations. And we also have a No on 3 campaign that you can participate in that I will also drop the link in the chat for as well. But I'll go ahead and let Melanie talk about other opportunities for advocacy and engagement.
Thank you, Erica. Um, Yeah, so other opportunities for advocacy and engagement. Again, I did talk about medical debt earlier. I think in addition to that, we're looking at some data around medical credit cards. I think especially keeping in mind the not just the changes with funding coming down from OBBBA, but really the expiration of the enhanced premium tax credits and the folks who are going to find themselves without insurance because they can't afford that monthly premium. So folks turning to other entities, and I think medical credit cards, there's no they're treated like regular credit cards as far as I understand so far, and just doing some initial digging. But we have some folks who are going to do some in-depth research and just pulling the data to see, with us being the state with the highest number of ACA enrollees, I definitely think that that's kind of a looming issue. Like, yeah, we have a lot of medical debt in Florida, but medical credit cards is kind of in its own lane because it's technically like I hear it and I'm thinking, yes, that's medical debt, but it's treated like regular consumer debt. So that's a huge red flag. And, just trying to figure out how we can kind of get that in the same section as medical debt and get some protections. And, there's no like guidelines or restrictions around a provider, for example, pushing people to that option if the person can't afford like whatever service. So having a credit card pushed on you by your doctor's office, you may feel like it's an appropriate option, and you may not realize it's like a regular credit card. So we're definitely going to expand the medical debt. Like we had one bill this last session. I could see us running maybe something focused on medical debt and something separate, or we can do a bill together and still have two separate bills running. But definitely have to expand it to include credit cards. Maternal and infant health, the doula bills are one thing. There are some other issues around access to providers as well. I think that we in Florida historically have done a good job of allowing midwives to practice in our state, but there are different types of licensures and certifications for midwives, and just kind of clearing up that statute to make sure that midwives are able to practice. And also, I'm still learning and understanding, but there is so much to be said around just the confusion and the process that some of these providers have to go through to actually be able to become Medicaid providers or successfully receive reimbursements from Medicaid. And so some of them just opt out completely. So figuring out some different pieces of legislation to address that issue. And then some of the things I didn't list there, kid care. I mean, they're not just kid care, but looking at a potential Katie Beckett waiver and just understanding some of the things on the landscape for, especially for children, but especially for medically fragile children, and figuring out what things in statute need to change in order for these families to be able to enroll their kids in plans. So that's about it. We have a few good bills that we're looking to file next session.
So
Right.
thank you again for listening to us. That's our contact information. If you want to contact us, we're available anytime.
Before I announce the CLE code, I do want to drop these links again because Erica has been a rock star dropping links into the chat. I subscribe to both newsletters for the Policy Institute and for the Health Justice Project. They're always putting out a lot of great content, in particular for Amendment 3. I've actually shared some of the posts that I've seen in some of these meetings and webinars. I really appreciated that comment about the group chat because a lot of us don't know what's happening behind the scenes. So it's great to hear that story and how organizations can work together and collaborate and inform the public about what's happening. So a lot of times we see bills that pass, but we don't pay attention to the ones that don't pass and what's happening behind the bills to either defeat the bad ones or make sure that the good ones move along. So I have to say I really appreciate all the work that both of you do and on your organizations do because it's greatly appreciated and really helps people in our community. So I see a lot of thank yous. I'm going to go ahead and drop the CLE code into the chat and read it out loud. The CLE code is 26072994N. So I'm going to go ahead and drop it here into the chat. And don't worry, this is going to go out via email as well. And we will also have it in the YouTube description. So let's see. I want to make sure that if we have any questions that we don't miss out on any of them. So I'm gonna kind of scroll back up through the chat.
Yes, I can see
And
one. I can see a comment in the chat about this Amendment 3 property tax that I would like to address because it is a good point that there are seniors on fixed incomes that are struggling to pay their property taxes. We're running into this, and that is a big debate. I will say that the answer to this is that we're trying to save our services in the state. And so our approach is that there's a more equitable way to provide relief for housing costs that don't center around these extreme cuts to our city budgets that will impact a lot of the programs we care about and impact the ways that we can pay for important things like libraries, police, and fire and stuff like that. So our approach is, yes, there's going to have to be conversations to be had, but with this bill, we haven't had the opportunity to have those conversations about what that relief looks like. And so that is our goal, is to approach this from a community standpoint and not just a way that's going to cut services while we flounder to figure out where the money is going to come from in the meanwhile. And so that's our approach to that.
let me take a look at the Q&A just in case I see any other questions there. Um, I don't see any other questions, so just wanted to take this opportunity to thank you again for an amazing presentation. Melanie and Erga, you did an amazing job. Keep up the great work. Keep us informed. If you're not subscribed to their newsletters, please do so. Bookmark their websites. They're always putting out a lot of great content. So thank you, everybody that joined us today, and have a great rest of your day.
Thank you.